Hi, my name is Adam Klingsheim, and I would like to welcome you to the presentation, Patient Communications During the Pandemic and the Impact on Your Hospital's Revenue Cycle. I have with me Matt Leventhal, the Regional Sales Manager for SmartSource, who has over 20 years of experience with developing effective patient communication methods. Matt, we have several questions that we would like for you to share your well-informed opinion on. Matt, are you there?
I'm here, Adam. Nice to talk to you.
We have a few questions. Our first question today is going to be, as a supplier to the medical industry, what do you see as changing trends?
Um, yeah, a few different things. Not so much a trend. It's been a trend over the past couple of years, but a focus on the revenue cycle has been a highly escalating priority for healthcare organizations.
Okay, and why is this trend more important than other initiatives, and what is unique here?
What's unique here is the coronavirus, COVID-19, where as an industry, there is a hyper focus on finances. There's a lot of reduction in revenues due to the lack of elective surgeries and other procedures, and their ability to revamp and fix the revenue cycle is going to be the difference for a lot of them, that if they're going to make it or not make it financially.
So, when you say fix, what are you specifically referring to?
Yeah, that's a great question. There's a couple of things here. One is, I would say, tactically, and one is strategic. On the strategic side, the revenue cycle doesn't necessarily start with the bill payment. It starts at the beginning of the relationship and follows the patient journey. We see a lot of organizations who are hyper focused on getting the payment, but are not focused on every step of the way of the journey. So there's losses in revenue for poor communications up front, as far as pre-arrival. If patients don't know where to go, don't know what to bring, don't know what preparations to bring to do before their appointment or procedure, there's lost revenue there. Especially now with COVID, there's different areas of the hospitals and facilities you can go into, you can't go into, and there's a lot of different, regulations. And how do you communicate that? So that's all the way through the entire cycle to the bill pay. As far as, I would say, tactical, it's there's a big siloed approach where you've got different departments and different parts of the organization kind of communicating in a vacuum. So there's not a holistic 360-degree vision of what that communication cadence should be and what methods it should be in, that follows the entire patient journey, from starting to look for services all the way through to paying their bills. Lack of mobile tools, digital tools, and all the different channels to communicate the way patients want to ingest it and make it easy to pay, are definitely things being looked at higher levels and at higher rates than we've ever seen before.
Okay, thanks for clarifying that. Our final question is going to be, if a hospital is financially strapped, how can they afford these dramatic changes?
That's what's really exciting here, Adam. Revamping the revenue cycle and really taking a look at it is funded by the costs the hospitals already have. The money is already being paid for these services, but now you can combine communications, add marketing communications into it, health education communications into it. And we know that, relationships that start well end well, meaning from first contact, a consistent message all the way through to easy to read bills and tools to make payment easy is gonna, it's going to make the patient journey, the patient experience, and the revenues of the hospital continue to improve. And in today's environment, those are the critical pieces we're seeing at the highest levels of all of our clients and all of the industry.
Wow, Matt, that was a lot of great information. Thank you for your time today. We really appreciate it. If you would like to contact Matt Leventhal directly, you can find his contact information currently on the screen. My name is Adam Klingsheim. Happy New Year, and I'll see you next time.